Hello, and welcome to POMA Does, a podcast produced by the Pennsylvania Osteopathic Medical Association. We provide a voice for osteopathic medicine and share insights on issues important to osteopathic physicians, residents, and students, as well as those who embrace the osteopathic philosophy. POMA's mission is to promote the distinctive philosophy and practice of osteopathic medicine for our patients, our members, and the communities we serve. Thanks for tuning in.
Hello and welcome to the latest episode of POMA Does podcast, sponsored by the Pennsylvania Osteopathic Medical Association. I'm Syed Arian. I'm a third-year family medicine resident at Lehigh Valley School program. I went to the Pennsylvania College of Osteopathic Medicine class of 2023. I work as the resident member of the Digital Engagement Committee at POMA, and today we're going to explore a topic of tips and tricks for interns. I'm privileged to be joined by Dr. Oveh, Dr. Alwaeli, and Dr. Shabbir, who also happen to be my co-residents. I'd like to start by asking each of you, what are some of the common challenges that you see interns face?
I think one of the challenges that I see interns face is transitioning from being a medical student to actually now having to practice as a doctor. The responsibility that comes with it, knowing how to do a complete assessment, putting your orders, and following through on your orders. Sometimes it can be a little bit overwhelming because before in some situations, you were more as an observer, but now you are now responsible for actually following through on your orders, making a diagnosis, and actually following through on the treatment. So that's kind of one of the challenges that a new interns might face on the clinical side. In regards to a life outside of the clinical side, some of the challenges as well is also the amount of hours you spend doing patient care. Finding time for yourself to do something outside of medicine, it can also be a challenge as well. So being able to have a work-life balance is something that can be difficult to navigate as an intern, but you get to learn it as time goes on.
Yeah, I think I'm going to have to agree with Dr. Oveh. I think all fair points. I would add on that getting used to a health system is very difficult. You know, most of the times this is not something that we do as medical students. So getting used to the health system, getting used to the EMR, getting used to the hospital, the layout, getting used to the attendings, their styles, all of that, I think, goes into account of some of the challenges that interns face.
And I agree with Dr. Shabbir and Dr. Oveh. I think everything that they've mentioned, not only the challenges that we face, but also a lot of interns that, especially with my new co-residents, I've been noticing all these various things. I think something else I would like to add is just time management. You are faced with an overwhelming amount of responsibilities. And if you're unable to manage, things from finishing your notes on time, having the orders in, discharge orders in at a specific time, or you will be faced with a lot of text messages from case management, nurses, and it can be quite overwhelming. And on top of that, especially during the first couple of months, you're trying to get used to and navigate through a new EMR system. And on top of that, you need to have everything, set in stone, and that can be quite difficult.
Yeah, I definitely agree with a lot of what was said. A lot of the audience members are going to be interns who will be listening to this podcast that are only in their first few weeks of residency and have yet to experience some of this. If you recall back to when you were interns addressing some of those challenges you brought up, what were some things that you did that helped you got through?
I think relying on the seniors who were available in the residency program was such a great help. Asking questions, not feeling like you need to know everything. I think one of the perceptions interns have is they believe that becoming a new doctor, you are expected to know everything. You are not expected to know everything. You're supposed to have a good medical knowledge, but the ins and outs of managing patient care day to day is something you learn in residency. So being able to ask questions and being able to study outside in your free time in ways that can help you address knowledge gaps and help you in your clinical skills as you go day to day.
I think it's very daunting when you're going through that transition, especially in the first couple of months. And I think one of the things that really helped me through that transition was telling myself constantly that, number one, I made it. And number two, that this is just a process. And as long as I put my best foot forward and I give it my all, put some hard work into it, then it will be fine. And now I'm a third year. So you just have to be positive And I agree with Dr. Oveh that you really have to use the resources that are given to you. One of the best resources that you can use are your seniors, because they've been through the exact thing that you're going through now. So if interns are listening to this, I just want to let them know that everything's fine.
And just to tie things back to the time management, I've always been a big procrastinator. I've always left things towards the end and managed to do well in med school. But with the patient volume and all these different things, I knew I had to make significant changes. I had to do this early on, or else I'm going to fall behind. Everybody's going to be upset, including the patients, and I need to make changes. From day one, I made my daily schedule more structured. I looked at my schedule. Our program provides us with this new innovation thing. It's a platform where we have our schedule for, the next 6 months, sometimes a year. I would print out my weekly schedule. I would add on what I need to do as far as, let's say I'm in the clinic for this specific day. What time do I need to be there? When should I complete my notes? Just having a nice structure for my days that served me well. And I highly recommend just being more organized with your time. And that's the best advice I can give.
Yeah, I think one of my personal challenges was being efficient, especially after a full day of clinic where you have, anywhere from 16 to 20 patients and wrapping up notes. Definitely hear that from the time management perspective. And also to Dr. Oveh's point, there are knowledge gaps. They will be uncovered. It really helps to be a humble intern because the experience tends to be humbling. And if you are not afraid to ask questions and reach out to your senior residents and your attendings alike, they oftentimes appreciate that more than, going in with maybe a slightly bigger head. So as far as the next question, it ties into some of the things we maybe discussed, but share your experiences with imposter syndrome and how did you deal with that feeling during the first few months of your training?
Well, like I said, being an infant, you've gone through a couple of exams and those exams test your medical knowledge. You've gone through step 1, you've gone through step 2, where you studied some of the most common diseases. That's why those diseases are emphasized. And those are the most common diseases you're going to see when you start to practice as a new resident. And so believe in the fact that, yes, you've studied and now you just have to apply it. So it's a fear that everybody has to go through. But the more you do it, the more you feel comfortable doing it, you become more comfortable as you go. You already know the knowledge. You've already passed these exams. You're just applying it in practice. Having that at the back of your mind will definitely help overcome that feeling of being not adequate, especially when you start out.
And I agree with Dr. Oveh. Imposter syndrome hit me really hard during the first few months. I felt like I didn't belong, especially when attendings are discussing very complex cases. But to deal with it, I just reminded myself that everyone starts from somewhere. These attendings were not born with this knowledge. They were interns at once, and it was a process for them to be where they are today. And I think I had to remind myself what my strengths are. And the biggest strength that I had was asking questions. A lot of people view that as a weakness, asking questions, but personally it has served me really well. Not being afraid to ask questions. There is no dumb question. Everyone understands that, and you're expected to ask questions. Another thing was connecting with peers who felt the same way, just so we can have that discussion and just, it's reassuring to know that you're not the only one going through it. So that's how I dealt with it.
I'm going to be honest. I think sometimes it still hits me from time to time. I feel like that's a feeling that's going to stay for a while, because I feel like it even happens with third years or fourth years, getting out of residency and finally becoming attendings. And then now the imposter syndrome kicks in again. My way around it, because I feel like alluding to what Dr. Oveh was talking about earlier with the knowledge gaps, I think that's what made me feel most inadequate about being an intern, about being a new doctor. And I think the way I was able to combat that is by using UpToDate and AMBOSS. For me, those were really essential, especially with hospital medicine, because that's where we do the bulk of our learning. So during hospital medicine, when I was seeing patients, I would always have UpToDate pulled up or AMBOSS. Any questions I had, of course, you ask your attendings, your seniors. You can always ask your peers as well. For me, I think self-learning is very important. So I always had those two resources pulled up on my computer. And if I had any questions, I first tried to answer it myself. You have to be inquisitive. Again, we're learners. So I would answer it. If there was anything that was left unanswered, then I would ask the attendings. But I think that really helped me close those knowledge gaps and actually be a better doctor.
Yeah, I certainly hear that. Any new case or maybe a more complicated case that you haven't dealt with in a while, sometimes you do need to reach back out to those resources. And you often, in the back of your mind are asking yourself, am I in a good position to, manage this case, or do I know it? And I think if you reach back far enough, you have some of those essential pieces of knowledge, but sticking to a few viable resources and often referring back to them has also served me very well. So next, I'd like to ask, what is one major pitfall interns should avoid? One recommendation for upcoming interns or current interns on what they should avoid.
There is a difference between being confident and being cocky. So because you're not a doctor and you feel cocky, it might not sit well with the seniors and everybody attending. It might rub people the wrong way, and you're not going to come across as someone who's willing to learn. So being humble is always a strength, and it's something that I think interns should try to emulate. So being cocky, yes, you might be the smartest person in your class and you might have done very well on your boards, but now as an intern, you're starting all over again. So it's always good to be humble and try not to be cocky, especially when you're trying to ask questions, come across as being humble. It goes a long way.
Right. And I agree with Dr. Oveh, just not being arrogant, be willing to learn. And, medicine itself, it's a team effort. We've got people from different specialties. We have nurses, CNAs, doctors, PAs, NPs, people from various walks of life. And everyone has the same goal, which is to provide the best care possible for the patient. And you really want to work together, do everything alone. You want to talk to your nurses because they're spending more time with the patient than you are. Sometimes you may mistake on a physical exam. Maybe you didn't have a thorough discussion with the patient or family members who were there when you weren't there. So ask questions, talk to, this is a team effort. I know it's really hard for some of us who are introverts to kind of just try to complete our notes, put the orders in without really talking to others. I think that's something you should avoid.
I'm going to have to agree. You got to leave that gunner mindset in med school. You can't come with that. I mean, you have to completely change your personality. But again, humility is really what's going to save you as an intern throughout the rest of the residency. But my point is going to be finding the balance between work and life. If you do not find that balance early on, it is very difficult, because you get caught in that trap of constantly having your mind turned on and just working. And we already know physicians have a very high rate of burnout. So it's very important to find that balance early on, knowing when to just turn everything off and focus on yourself.
Yeah, I think those are all great points. And I'd like to add on a mistake that I've seen several interns make is maybe making up information. If you didn't listen to the heart, maybe go back, take that extra couple of minutes and re-examine the patient, because once it's documented, then you're held responsible. It's no longer case simulation. You can't go back and change things. So if you didn't ask a question, go back and ask it. If you didn't listen to something, go back and listen to it. And then this brings us to our last question. Share one golden tip that has served you the best.
For me, try to do questions every day. 5 to 10 questions daily goes a long way. Even in residency, we get to take annual exams, which are called IE training exams. If you do questions every day, it keeps you fresh, it keeps you sharp. And some of the question banks, the questions that are asked kind of like replicates what you get to see on a daily basis. So doing questions every day is very important.
One golden tip that I would, give to any intern is just to remain curious, be teachable, be willing to learn. Again, that goes with humility, as Dr. Oveh and Shabbir mentioned earlier, but always ask why. When you're opening up a patient's chart, let's say you're admitting them to the hospital for congestive heart failure exacerbation, ask yourself, why did this patient not take any medications? Is there an issue, financial issue that we're not aware of? Has this patient had any cardiac procedures done in the past, any stress tests? Keep asking why. Be like an investigator. Try to dig really deep into the patient's history. You don't want to just say, here's a new patient, this is what's going on, we're going to treat, send them back home. We want to prevent readmissions. We want to do the best thing possible for our patients. Always ask why and remain curious. I know it gets really overwhelming when you have a huge load, a lot of patients, but I think that served me really well. That's what got me through residency, and it just prevents burnout. Yeah. That's my advice.
So this is, I think, more for outpatient because that's something I personally struggled with, essentially time management. When you start out as an intern, you really want to fix every patient that you come across. And that's just an impossibility. You can do it, you can do it over time and get them to a healthier state. But I think in terms of time management, setting the agenda with the patients is extremely important, especially once you get to higher levels and you're starting to see so many patients, the burden can start to accumulate. So setting an agenda, making sure that your patients understand that you can address, this many issues. I think that's very important. Getting into a habit of doing that while you start out is really going to pave the way for you, for your success.
Yeah, I think if, our interns implement any one of those tips along their journey, it will serve them well. I think to piggyback off of Dr. Shabbir, your point, burnout, picking one thing outside of your clinical responsibilities that you enjoy doing, whether for you that's, a Starbucks coffee, whether that's going to the gym at 5 a.m. before your rounds, whether it's, binging Netflix on your weekends, but just pick that one thing throughout your residency training and hold on to it, because that's what will ground you, what keeps you mentally stable and physically well. And I thank each and every one of you for your time this afternoon. I feel like our interns have a wealth of information to refer back to with this podcast, and I would advise them to listen to some of this information later on in their intern year just to remind themselves, because it's often a couple months in that you start to experience some of the burnout. And if you have any feedback or any episode ideas for upcoming POMA Does podcasts, please email POMA@POMA.org, and be sure to subscribe to the POMA Does podcast series on your favorite podcast platforms. We'll see you next time.
Thank you for joining us for this edition of POMA Does. Be sure to subscribe to POMA Does wherever you listen to your podcasts, and tell your friends and colleagues to tune in. Learn more about osteopathic medicine and POMA on our webpage, www.poma.org, and join the conversation on social media. We're on Facebook, Instagram, LinkedIn, Twitter, and YouTube. Or email us at poma@poma.org. We'd love to hear from you. Join us next time for another edition of POMA Does.